Morning, afternoon, and evening, everyone. I, Deepika Saluja, the co-founder of Women in Global Health India chapter, heartily welcome you all on behalf of the whole WGH India family, its co-founders, advisors, and members for joining us in our one-year anniversary event. We are thrilled to be completing 1 year of WGHI efforts and all that we have managed to achieve in this one past year, particularly given the unprecedented times that we are in. After a super power packed opening plenary, I'm pleased to take the conversation forward and welcome you all to the plenary 2 on celebrating WGH chapters journeys, pushing the gender equality agenda in global health forward. The momentum built around gender equality and representation and concerns highlighted through the WGH movement across the world by its country chapters is a testimony to our collective action, providing space and opportunities for women to share their experiences and articulate their demands, having more women at the table, building coalitions and partnerships, etc., have played a crucial role in pushing gender parity on the political agenda. However, as highlighted, male leadership continues to dominate political spaces within the health sector in many countries. Thus, women based and women led mobilization efforts at all levels, from grassroots to the executive level, need to be strengthened to make a dent in how global health policies are designed and implemented. COVID has re-emphasized the value and centrality of women's engagement and leadership in responding to the pandemic and building resilience and equity in our health and social systems as we move towards the recovery and reform stages. Thus, on the occasion of WGH India's one-year anniversary, we want to celebrate the collective efforts and diversity of WGH chapters, bring together some reflections and learnings from our COVID 50/50 campaign, as well as from our pre-COVID times from different chapters on their journeys of pushing gender equality agenda politically forward in their specific country context. This is also an effort to reflect on what we can learn from each other as chapters, build solidarity and support, and collectively work towards a greater global cause. WGHI takes pride in amplifying the voices and contributions of different cadres of frontline health workers to the mainstream health policy discussions and changing the narrative around their engagements in key policy discussions. And like WGHI, several other WGH chapters have engaged with key issues around gender equality and challenging the status quo in their country context. So we will hear some of it today in this discussion. I would like to begin with introducing Anne Keeling, who is the Senior Fellow with Women in Global Health and also the Chair of the NGO Age International. Anne Keeling, her 35 years of career in international development includes several leadership positions and enriching experiences from Pakistan, Indonesia, the Caribbean, Belgium, United States, and her home country, UK, with organizations like British Council, DFID, UNDP, UNFPA. She has vast amount of experience and very enriching experiences to share with us. So Anne, over to you to share with us briefly on the WGA journey and the COVID 50/50 campaign. Thank you.
Thanks, Deepika. And first of all, I'd like to say what a pleasure it is to be here and celebrate with you the first anniversary of Women and Global Health India. It's amazing. I'd like to start with a personal story from the time when I worked in Pakistan. This was 30 years ago. I was working for the UN and a donor had built a brand new maternity hospital in the capital. And it was shiny and it was bright. And even the manhole covers had been imported from Japan. But the donor came to see me in the UN and said they couldn't understand why the level of maternal deaths was so high. So that afternoon, I went to the hospital and I went and sat in the admissions, and I found exactly what I thought I would find. Relatives came in, one group after another, with women in labour basically dead on arrival. So it was dead on arrival. It was dead on arrival, or women came in such an ill condition that they died very shortly after arrival. And I'm telling you that story because I wish I could say that 30 years later this couldn't happen, but I'm not convinced. And that hospital was built by a donor, and no women were involved in the design of that. There were no women in leadership, there were no women in decision making, not in the donor organization or in the local group that designed that hospital. Women in the community, local midwives were not consulted. And then finally, and I think when we talk about decolonizing global health, you look at that. So when a problem was identified, who did they come to? They came to a foreigner. Did they go and talk to the women who were running, the midwives, the nurses, the doctors who were running that hospital? No, they came to talk to a foreigner in the UN system. And for me, it just says everything about what happens when you marginalize women in leadership. And I think what we're talking about here, it's not something tokenistic. It's not a luxury. We're talking in global health about life and death. And I think, we've seen it in the COVID pandemic, that when you marginalize the views and the experiences and the expertise of the women who understand health systems and who understand global health, then actually people die. So this is a very, very serious situation for me. And that's why we have global health, women in global health, as far as I'm concerned. So that's really where I'm coming from. Women in Global Health has had a remarkable 5-year journey. I haven't been there from the beginning. I came on board 2 years after it was launched in 2017. Women in Global Health was launched by 4 early career women who'd never met each other, and they met on Twitter. And I want to talk about 4 points about the journey for women in global health. But the first point really relates to that. Women in Global Health is a movement of the 21st century. Before social media, before the ability to organize in a virtual space, if women wanted to influence policy, they had to join, as I think we've heard speakers talk about, a trade union, a political party, a bureaucracy, where they would start at the bottom and often be discriminated against. There's actually, I think, as we've seen from the Me Too movement, there's something that can be very democratizing in a new way of organizing for the 21st century when it works for it at its best. And Women in Global Health is, I think has been said, it's a totally unique movement that works across different sectors in health. It's open to all genders. It aims to be as inclusive as possible, because I think we understand that we need everybody that we can at the table to work with us. My second point is that Women in Global Health has been driven by woman power, and it still is. Most of the people that work for Women in Global Health and have done are volunteers. Most of the women who work for Global Health have other jobs. They have day jobs, just as Rupa Dutt has a day job as a physician. And Women in Global Health is her, I don't know, her night job. I have no idea. But Women in Global Health wouldn't exist if it wasn't for the women who step up, as women do in many organizations. Step up, do a job, move on, no egos. So there have been hundreds of women involved, maybe more than hundreds, involved in building Women in Global Health over the last 5 years. Most of whom you won't know because they've done their job, they've made their contribution, and they've moved on. And I think it's really important to remember that we stand on the shoulders of an army of women who have been inspired to join and drive this movement. Thirdly, I think it was always the objective to grow a global community and Ilona Kickbush talked about, the spirit of solidarity, equity, and rights. And this isn't tokenistic. It's about bringing diverse voices into global health because they need to be there. It's about trying to overturn the balance in terms of gender and geography, because global health needs to learn. It's been largely driven by one perspective, and it's weakened. Global health security, global health systems, all our planning are actually weakened by not having diverse views at the table. The growth of national chapters hasn't kept up with demand. The demand for national chapters is enormous. So we have 24 chapters now. I think we'll probably have 50 chapters by the end of the year. And I think we will just continue because the demand is enormous and the need is there. Fourthly, when we're advocating for gender parity and leadership, we're talking about going beyond that. And we had a discussion this morning about feminist leadership, about a different style of leadership. So we're not just talking about counting men and women, genders. We're talking about who's at the table. We want diverse women at the table. We want diverse men at the table. We want other genders at the table. We want diverse geographies. And we want a different leadership style. And in Women in Global Health, we're calling that gender transformative leaders. We want everyone of whatever gender to be a gender transformative leader, to be challenging equity and gender inequity particularly, because this really is everybody's business. So we're looking for a new leadership style. There was a discussion this morning about engaging men as allies. And I think we're very much aware that we want to move outside the echo chamber that we have worked in, and we make an effort to do that. We've recently started work with the Global Action on Men's Health, which is an alliance on men's health, because we recognize that in terms of gender equality, unequal systems, gendered health systems, disadvantage men and men's health just as much as they do disadvantage women's health. So actually, gender equality in health systems is good for men's health as much as it's good for women. And patriarchy is very bad for men's health. And we can talk about that later. But I think one of the big selling points that we have is to say that the system that we have, the gender inequitable system that we have now, is actually not benefiting anybody's health, apart from an elite few. COVID-19, I think, as we all know, has exposed very, very deep inequalities that were already existing within countries and between countries, including gender inequality. And that gives us an opportunity, while people's attention is focused on health, I think it gives us an opportunity to push forward this year many of the things that we've been saying in the past. But I think politically, we're going to be listened to more this year than perhaps we would have been 2 years ago. So I think we have a huge opportunity. And I'm going to hand over now to my colleagues in the Women in Global Health chapters to talk much more about COVID 50/50 and to talk about the work that they're doing. Thank you.
Thank you so much. Thank you so much, Anne, for sharing your journey and how did it all started and why sadly we still don't see much improvements, and how long and how far we have to go from here. So we'll be reflecting on some of these issues that you have highlighted in our panel discussion moving forward. And I'm so excited to sort of share that we have a very young and vibrant panel today comprising of WGH chapters lead from across the world. We are joined by Lanice Williams, the Vice Chair of WGH Washington, DC chapter. Currently, Ms. Williams is working as a gender integration specialist with Encompass Limited. Lanice was a Global Health Corps Fellow for 2016-17 batch and has MS in Health Education from Harvard University, and also serves as an adjunct lecturer there. Then we have Flata Mwale, the co-founder and deputy lead of the WGH Zambia. Flata is a biomedical scientist with a recent master's in global health implementation and has worked mostly around HIV programs and is currently serving with the Ministry of Health Zambia. We're also joined by Kaisa Lahatepuro, the chair of the COVID-19 task force at WGH Finland chapter and is also a part of the core leadership. She works as a senior specialist on global health at the Finnish Ministry of Social Affairs and Health. Kaisa holds double masters with focus on international relations, gender, economics, and business. And last but not the least, we have Becca Reisdorf with us, the co-founder and co-lead of WGH Chile. Becca is currently completing her part-time Masters of Science in Public Health. She coordinates the women-led and women-focused project Conversemos Mama, which supports and empowers pregnant women and recent mothers during the perinatal period. With this brief introduction, I'm really excited to begin our discussion with Lanis from the DC chapter. So Lanis, we have, like all of us have been following US politics and like the entire world now, we are very hopeful of this new Biden administration and having a female vice president. And on how do we integrate gender equality into the agenda, administration, and policies. We would like to hear from you about your experiences of advocating for this in the early months of the new Biden administration.
Can you all hear me?
Yes.
Oh, okay. I just wanted to make sure. Hi, good evening, good morning, good afternoon, depending on where you are in the world. Thank you for having me. I would say from the Washington, D.C. chapter of WGH, we have not engaged the administration yet, but we just recently had an executive committee meeting and talked about a couple plans on how we would like to engage the administration, but also hold them accountable for a lot of the things that they have put forward. So for example, President Biden in his agenda for women has talked about the importance of improving economic security, expanding access to healthcare, and tackling health inequities, as well as helping women navigate balancing both work and families, ending violence against women, as well as protecting and empowering women around the world. So while a lot of that, his promises are not quite clear, we're from our chapter's perspective, we're looking to do a landscape analysis of the different offices within the various government agencies that do exist that are talking about tackling gender equity as well as gender equality. We want to get a little bit more further, figure out what the agenda is. How does the president plan to work with members of Congress, as well as different governments around some of these things, right? So we know that some of the things that he'll like to focus on is, of course, ending the wage pay gap that exists among men and women, but also when we look at the wage pay gap, when we look at it by women of color, we know it's substantially large in comparison to their white counterparts. So we're hoping to, once we do this landscape analysis, to figure out how we can better advocate for a lot of the different policies and the 7 acts and the 5 acts within the COVID 50-50 that Women in Global Health team has put forward, but also how we can work with the White House Gender Policy Council. So President Biden has announced that he would revamp, under the Obama administration, it was the White House Office on Women and Girls, to the Gender Policy Council, which will focus on tackling issues of gender equality and gender equity, both not only in the United States, but globally as well. So that's some of the plans we have so forth from the DC chapter perspective.
Thank you so much for sort of setting the context, and we'll come back and reflect on some of how we can move ahead with this. Maybe with this sort of yeah. So maybe with this sort of starting, we move on to South America, and we have Becca from Chile. The social revolution that started in October 2019 called for a new revolution, which was voted for gender parity 1 year later, and by nearly 80% of its voters who voted for gender parity, and that was advocated and amplified by various grassroots feminist organizations in Chile. So could you share some reflections from the experiences of women pushing gender parity in this new constitution?
Hi, Deepika. Hi, everyone. Thank you so much for having me. Yes, I would love to share some of the experiences that we've had here. So as Deepika mentioned, in late 2019, there was a social revolution that started, which called for massive change in most of the social systems here in Chile, which is a very privatized system since the dictatorship in the 70s and 80s. And so all of this culminated in a call to write a new constitution for the country, because the current constitution is from the dictatorship. And so this, when the government agreed to write this new constitution, feminist movements, who were very much a part of the general movement as well, called for this to be written in a gender parity form. So what basically happened is that all of the organizations, collectives, and groups that had been a big part of the movement in itself, that had been on the streets every single day in the marches, got together virtually and pre-COVID times also in person in public spaces to discuss the ways in which this new constitution could be a feminist constitution and could create the gender equality that they had been fighting for so long. And so the thing that came out of this was to ensure that gender parity was part of this constitution. And this was voted in March of this year, so just before the pandemic started. And really, it's been a long process that these feminist groups have done, and the way that they have organized has really been through public spaces, and now in COVID times virtually. There's events and talks and stuff all the time. They get together, and it's something that we've really seen here in Chile that has had a very strong impact, is getting together, getting all of these groups together and helping them formulate the ideas and thoughts that they have, which in this instance culminated in gender parity for the new constitution. So now what we are hoping for is that this is ensured, and that the gender parity is not only ensured in the sense that 50% are women and 50% are men, but that those 50% women are also diverse, and that they're representative of the entire population, and not just the elite and high income women who are at the moment leading the government. So that's basically what the experience has been in Chile. I'd love to talk about it more when we get more into the discussion later on.
Thank you so much, Becca, for sharing that. And as you rightly pointed out, I mean, when we refer to women leadership, I mean, we need to consider it across the spectrum. And as it was also highlighted in the previous session, that the maximum impact and the change that we see, it really happens from the grassroots movements and the collective action that is happening on the ground. And you were sort of reiterating that point. Thank you so much. Moving on to perhaps Zambia chapter. So the context within which we are championing these gender equality issues, it's actually complex, and this has been highlighted earlier by Becca and also in the previous discussion. This is constantly perpetuated by various cultural and societal norms for women and girls. So Flata, could you share some reflections from Zambia on how do we actually hold the government accountable for the commitment towards gender equality when we are fighting for such deeply ingrained beliefs and patriarchal norms? How do we really hold the government and the administration accountable for its commitment?
Thank you, Dee, and congratulations to you and your team. It's quite a timely event as we look forward to commemorating International Women's Day, which also centers on women in leadership. So it really does have an impact on how we build the momentum to next week. Thank you so much. And as you have put it, Zambia, like any other context, has a lot of gender inequality embedded in quite a number of aspects. And they're more than just gender issues. There are socioeconomic issues, there are religious issues, and all these factors that we have to address. And of course, the government has a political environment that's very, very conducive for it. We have a Home Ministry of Gender that's supporting the move for gender equality. But again, at the end of it, you realize that if we are to perpetuate and push for leadership among women, we must raise the young girls as well. So within the Zambian context, it not only means we have to move on as women who are empowered and women who are capable, but we have to get to get education, young girls that are unable to identify opportunities, so that we can raise such leaders to take up the leadership positions. But also holding governments accountable is really important. And I think Ilona in the previous discussion had alluded to that there's very little data that is showing progress as a chapter are aiming to work together with other social networks, especially key stakeholders, including government, on coming up with systems and frameworks that would help the government be held accountable so that we are able to monitor the progress. I think sometimes you will agree with me that it's not enough to just have appointments of female in offices. It has to be practical, and we have to feel the impact of having women in leadership and not just make it monumental. So there is need for women in global health as a national chapter to engage more strongly with other stakeholders and hold governments accountable.
Thank you so much for raising these concerns. I think this is very interesting because the conversations that we had in our first opening plenary and how we are discussing some of these issues within specific country contexts, it's sort of the points reaffirm the challenges that we are facing and how do we go about that. Including that even having women in the leadership position isn't enough, and what kind of leadership they're forced to follow, and what kind of leadership they're rewarded for, and that doesn't really transform the system, etc. So very interesting, and we'll come back more discussing on this. Moving to Finland chapter, so Kaisa, we see Finland as the epitome of hopefulness for gender equality. And from our context and many other countries, we always aim to reach where Finland is. We are curious to hear what are the key issues around gender equality that Finland is fighting for. If you could share some reflections from your work with WGH and beyond that.
Thank you very much, and thanks again for this opportunity to attend and participate in the discussion. And congratulations for your anniversary and for the wonderful discussions today. They've been really inspirational. Like your chapter from the beginning, I have to say, we are also a young chapter in Finland. And I feel that you have really achieved a lot during the pandemic time. And it's really good to learn from you and also the other speakers here. So thanks again. I think in terms of challenges here in Finland, there are many. We have to do much better in many areas. But I could mention a few, especially with a view to the pandemic. We have, so I would say that gender burden of care and the overall stress on psychosocial resilience and mental health is really something to focus more attention to. We have a fairly segregated job market here in Finland, and as globally, women make most of the health and social care workforce. As well as work in these, we call them essential sectors for the society, where you also often cannot work from distance. I think it's about 70% women there. But at the same time, women usually take care of children. They take care of their parents and other relatives as well. And we do have a large aging population. So in terms of both informal and formal care, that is a big factor as well. And even if we've done fairly well, at least so far, in terms of morbidity and mortality during the pandemic, there are a lot of impacts that we don't have a clear picture yet. And here there are a lot of health impacts in general in many areas, but mental health is definitely something that is quite difficult to track and that can be seen in a long term. And I think that Finns and also Finnish women are known to be quite resilient, and we tend to be also proud of it. But really the health and social and economic concerns and the simultaneous juggling of care responsibilities is something of concern here. But then I guess another part would be the overall and also global phenomenon of exacerbating inequalities. As is the case globally, it has really shown the role of social determinants of health, and gender clearly a very strong one there. I just mentioned older people, but we do have a lot of concern also about young people and how it might impact their life course in the long run. We have previous experiences also from economic crisis and know that and have data on how detrimental those can be. Young women are particularly affected because they often work in the service sector and with temporary contracts, and we also know that there's discrimination in the job market here as well. So I think that in general, it's really important to understand all these impacts, and we often say build back better. We have to do much better in terms of gender and try to improve all the time. And especially having the intersectoral lens is something important. I think there's a broad study in Finland among different institutions and universities on the gendered impacts of the pandemic. So that's of course something we look forward to here, and the media has also brought more attention to the issue. Highlighting again the importance of whole society cooperation. But I think just one quick last point is really the global nature of the pandemic and of gender inequality in general. So that's something where we have a lot of similar impacts than in other countries, from violence against women or domestic violence to SRHR access and other issues. And leadership has been discussed today. I think that's an area where we are never, hopefully we will be ready, but are not still. So I think just highlighting that the importance of this event today and the opportunity to exchange views with you all. So thank you.
Thank you so much for sharing and bringing these points back on the agenda around the triple burden of care, the gendered nature of how the responsibilities that women face on a daily basis, and the psychosocial impact that they have as a result of that. And also the labor market, I mean, how it is impacting the women and their work. So one thing that sort of I think that despite these different contexts and different progressive or regressive administrations and policies that we have in our country, so it sort of conveys the point that our issues continue to remain along these similar lines. We have been fighting for centuries for gender rights, and we still need to continue doing so for many more decades at least. I mean, if I can cite quickly, according to the Global Gender Gap Index, the 2019 report said that we would need at least like 108 years to bridge the gender gap, and so and the number came down to nearly 99.5 according to the 2020 report. So we still have like a very, very long way to go and continue fighting for these rights. So maybe um, moving on, maybe I, I would like to ask you all now that reflecting on how has been part of this WGH movement, how has it helped in challenging the status quo and within your own country context, and organizing collective efforts to fight against this larger cause of gender parity and women leadership. If you could reflect something from your specific context on how you have mobilized certain efforts as part of the WGH movement, it would be interesting to share um, some reflections around that. So maybe we can go, Lannis?
Yeah, so I would say, I mean, when we think about the movement of women in global health and the chapters, I think they have challenged the status quo from a global perspective with the work they've been doing with WHO, as well as what's happening within the country context, particularly from the DC chapter. Some of the things that we have done, we have held several thought leadership events, which we have engaged members of US Congress around challenging them, asking them the tough questions. What are they doing for not only their constituents and within their states, but what are they doing for women within the country, the United States? So, for example, we had one event where we had Congresswoman Stacey Plaskett, who is from the Virgin Islands. We had an event where we were talking about COVID-19 and its impact on women globally. And we just really got into the things and just talking about, you know, particularly when we look at the health workforce, particularly within the United States, we find that women, not only in the US, but globally, make up the majority of that. When we look at it within the US context, particularly when we're looking at certain professions, particularly when we're looking at certified nurses, assistants, majority of those women are women of color, right? And a lot of the disadvantages that they're put at, not only when we're thinking about pay, but the risk that they're putting themselves at on a day-to-day, particularly as we think about the COVID-19 pandemic. We also had another event a couple months later where we had Congresswoman Robin Kelly from the state of Illinois, where we talked a lot about how COVID-19 is impacting HIV/AIDS programming, not only within the US, but in a global context, and what still needs to be done to ensure that, you know, people are able to access prevention services, are able to access treatment, and are, you know, they're able to be retained on their treatment as well. So I think regardless of presidential administration, I think as a movement, we have done a lot of work with not only within our each country context, but on a global level. And I think, of course, there's always still more work to be done. And I really personally see, particularly with this new administration, there is a lot of hope and a lot of ways that not only the chapters in the US can be working with the chapters globally to ensure that we are achieving gender equality.
Thanks, Lennis. I think that's what sort of is the essence that we are talking about women in global health as the global movement. That how we continue to work on the country's specific context and efforts, but how does it sort of gets amplified when it is seen in collaboration with other country chapters and collected at the global level, and the kind of power that it achieves, definitely. Becca, Kaisa, so please feel free to come in and share your thoughts on how has been the experience within your own specific chapter.
Okay, I'll go first. I think that in Chile, we have a very particular opportunity and chance to really make a mark as women in global health because of everything that I was mentioning before. There's a big social revolution going on at the moment. There's going to be a new constitution, and 50% of those writing the constitution are going to be women. So women in global health has never been more important than at this moment. And we've really seen that as well reflected. One of our members who joined during the COVID pandemic, she is the current gender advisor to the president of the Senate, and she was able to get us a seat on a special commission hearing with 100 other civil society organizations where we drafted a law that we presented to all the different ministers, and that was then passed on to the president as well, looking to create laws in the future that allow for gender-focused responses to crises. So not just COVID, but also beyond. We know that this is not the last crisis, health or otherwise. And so having these kinds of laws and having these kind of gender really focused ideas, not only in health, but also in the different sections. We had about 6 working groups working from migration to health to education, and they all worked on bringing together the ideas of these 100 civil society organizations and presenting them and putting them into a package that would allow the different ministers and the government to take actual action in relation to the different concerns that were being that we were having during the pandemic. So one example, for example, is the equal pay for health workers and decent pay for health workers, which was one of the calls to action also of the COVID 50-50 campaign of women in global health in general. And we called for that as well, as Women in Global Health Chile being part of this special commission hearing. We called for this equal pay, and a couple of months later, there was a special grant given to all the healthcare workers that had worked during the pandemic and on the front lines. It was not a very big amount, but it's something, and I think that it really shows that this collective bargaining, what I think Sarah Hawkes called it intersectional collective bargaining, I think that's such a great term, and it really shows that when we work together and we get together as women and also allies, that we can really make a change. And Women in Global Health Chile has really showed that this is possible, and given us also the platform of Women in Global Health, which is now such a well-known movement and such a big movement as well, to call for these changes and to call for more gender equality and gender equity and health equity as well.
Thanks. Yeah, Flada.
Can I go?
Yeah, please.
Okay, so for the Zambian chapter, I think it's been really an incredible journey. Of course, we are yet to have a event is ready for us. We've received overwhelming support with Ministry of Gender, other civil society organizations that are championing gender equality. And yeah, I think what is striking is that Women in Global Health is not just another group of women trying to set as role models for young girls, but it's professional women that are setting their time and space to advocate so that there's more space that is created for young girls to also realize their full potential. I think that is something that's worth recognizing. Yes, it's no longer just about being a role model for a particular girl. It's women coming together, leaving everything behind and saying, we cannot just be the ones to sit at the table. We want every woman to have a chance and sit at the table. Yeah, so we have had quite a number of events, even in the waiting phase of the launch. We did participate in the 16 days of activism against gender-based violence, which was also great because we shared our thoughts around the area and also called on government to do so much more, especially our female leaders in cabinet. I mean, they have the leadership power to support the cause. We also have our members of the team, including our director, who have participated in assessments and programs around the impacts of COVID on maternal health services, both on national TV and in papers. Yeah, so even as we build onto the momentum of the International Women's Day, we already have national programs that we're engaging in. And I think what's very important for us is that we are not isolating ourselves. We are trying to work with everybody within every organization within the nation that is also championing the same goal, so that we add our voice and make sure that we work together. Yeah.
Should I add? Okay, thank you. So I think for us, at least, kind of the multisectoral approach at the core of our working has been an important aspect for the chapter. We wish to promote a multisectoral and also cross-disciplinary approach. We have members from the academia, from non-governmental organizations, private sector. I work myself in the government or for the government. And we have people from around Finland, but also people from abroad, and we also have some men on board, but I can't unfortunately answer the question yet here on the strategies of engaging men allies. So hopefully at some point. I think that the health in all policies approach is quite has a long tradition in Finland, and we tend to have fairly low thresholds in working together across sectors and actors. And this is a strength for global health work, we believe. But also, as discussed in the previous session, the aspect of ensuring diversity in leadership is something where a comprehensive and multi-sectoral approach is really important as well in terms of a feminist approach. And I think that not taking any progress granted is also very important. So we are now building a new advisory board and a new strategy in the next months or so, and really look forward and have noted down the discussions also here. It's really valuable to discuss and hear from you. I'm facilitating myself the COVID-19 task force of our chapter, and there are two subgroups currently. The other one is focusing on access to health services for migrant women in Finland. The other one has a bit more global focus in terms of access to sexual and reproductive health and rights during the pandemic. And actually our lead of that subgroup, Linda Gilby, has presented some of the findings of their work to the independent panel on preparedness and pandemic preparedness and response in January. And we really hope that the quite tangible observations and also lessons learned or good successes can be shared among the movement, the network here. And happy to put you also in touch with her and her team. And I think that one of the things is also just to have a platform for discussion that focuses really on gender equality and equity in global health. And then members of our chapter also take these ideas, knowledge, and approaches forward in their work to impact both the individual, institutional, and societal change. We are preparing to launch stories of women during the pandemic, also to highlight these aspects and create a platform for that. I think one of the challenges in terms of organizing ourselves, and here again, really good to hear from you, especially you in India chapter, you've managed to do a lot, but I think the pandemic has really been a challenge. It has brought a lot of opportunities for engaging virtually and kind of lowered some of the usual perhaps boundaries in doing that. But at the same time, we can all feel the toll of the situation, and it's a bit more difficult to build a network when you can't just meet in person. So that's something where we have struggled a little bit, and hope to do better in the next year or so. But those are some of my reflections, and thanks again.
Thank you so much for sharing the efforts that you have been making at your own country context. And it's sort of also very interesting to see how broad the spectrum is, and that we're not limited to one particular sector, subsector, theme, sub-theme, but the impact is seen widely, and the efforts are also made in all directions, legally, socially, from the grassroots level, while being within the government, changing the system, changing the narrative, and things like that. So maybe I come back to Anne, and if you could help us share some reflections on how do you see sort of all these efforts tying up and shaping the WGH movement at the global level?
Thanks, Deepika. I think it's really inspiring to hear what the chapters are doing. And I think at the global level, what we want to do is to support the chapters to lead. So it's not for us in a way to be giving you a blueprint, giving chapters a blueprint and saying, right, this is what has to be done. But we would like this to be a very democratic movement, really driven from the national chapters. What we gain at the global level is that we're able to bring very diverse experience and ground our global advocacy in really diverse experience and real stories from different countries and diverse communities. And that makes a real impact. It makes a real impact when we can talk about what's happening in Chile, when we can talk about what's happening in Finland, for example. So we really need that information. We really need those stories, I think, to add the richness to what we're doing at global level. Thanks, it's great.
Thank you so much. No, indeed, because this also sort of relates to the whole, decolonizing movement, decolonizing global health movement, and how, the conversation keep happening at a particular level, and the ground realities of the people who are working really close to the ground and to the communities, sort of those voices got missed out in the mainstream discussions, and the policies remain oblivious to what is happening really on the ground, and why it is important to include that, and not only include those voices through proxies, but directly hearing from them, directly hearing from these women from diverse backgrounds, and weave that into the policy that we are framing at the global level.
Yeah, I mean, I very much learned a lot from the series of webinars that you had about women's unpaid work and community health workers, and we were then able to take the voice of the ashes this week to a global level, into a global level discussion with ambassadors and member states and heads of global organizations. So yeah, it's really, really important for us to connect and really understand what's happening on the ground. That's why we need even more chapters than we've got now.
Exactly, indeed. Yeah, exactly. I mean, WGH takes pride in being able to do that, because when we were starting, it seemed like a very daunting task, and whether we'll be able to pull this off or not. But I mean, it just happened one after the other, and the support kept pouring in. The collaboration, in terms of members engagement, in terms of commitment of different partners, it was very overwhelming for all of us to engage and really pull that off. Very overwhelming, and also to see the biggest sort of immediate impact that we heard people sharing was that these were the voices that we haven't seen on or heard on any of the other platforms, and there were like millions of webinars happening at that point of time, and this is what was unique about WGHI Dialogue series.
And I have a real worry going forward, that right now, with everything being on webinar, we can bring different voices into global level discussions. When we were having physical meetings, say in New York, we had problems with visas. We had all sorts of practical problems. I remember we were trying to bring a fantastic community health worker from Liberia into the UN in New York, and her visa was refused. So right now, we're able to bring, in a way, women everywhere. I'm really worried that going forward, we might end up with, vaccine passports. We might, as vaccines roll out, faster in higher income countries than they do in the rest of the world. And it might be even more difficult for us to, for people from particular countries to move. So I'm really hoping that we can go forward with, with these meetings on more of a hybrid approach than they have been in the past. So I really hope that we don't go back to, fully physical meetings and then that we lose those critical voices.
Indeed, indeed.
Thanks.
Very, very valid point. Maybe there are a few questions in the chat box, and maybe we take some of them, and I also have a few follow-up questions. Let's see how much time we have. So maybe we start with what has been the most difficult barrier to question or challenge within your own specific context. Anybody who would like to go first?
I can go first.
Yeah.
I think that in terms of Chile, and I don't know if this is the same elsewhere, but from what I've been hearing this morning and also during this discussion, I feel like it is the fact that leadership in itself as a term is seen as something very singular, something that is a person, often a man, who is wearing a suit and tie and is very good at speaking, very good at expressing their opinions and everything. And I think that leaves out all of the different types of leadership, which are carried out on maybe not such a senior level, but on a more on the ground level. And I think that especially in Chile, and as I always refer back to this, but the social movement has really shown that. It's really shown that leadership is not just on a political and on a senior level, and it's not just male and white and old. It is everywhere, and it's young women and young people of color and indigenous groups who are really taking the forefront in all of these important discussions. And I think that it's really important going forward to rethink leadership. And I know that Women in Global Health really does this with this term, gender transformative leadership. And I think it's really important that we bring that to the table again and talk about it even more and define it, redefine it, define it for the different contexts as well, and not just in the global context. And I think that this is something that the chapters going forward, and I think it would be really great to have a co-chapter kind of event on this, to redefine what it really means for us to be leaders, and what does leadership mean, and what does gender transformative leadership mean, so that going forward, the chapters are able to showcase the different leaders that aren't just people in high level position and politicians, but that are people from everywhere, from civil society to social movements to youth leaders as well, which is something really important. So I think that what my main point that I want to make is that I think it's important to rethink the language that we use in global health. And that is one of the big challenges, because we have defined the terms that we use in a very certain way. Even global health in itself is defined in a very certain way. But as we were talking to Deepika about this before this event, everyone understands it in a different way. And so I think it's important to understand how different people conceptualize these terms. I think that's what I wanted to say.
Thanks, Becca. And I would also like to sort of bring this up, that during my prep calls with these speakers, I mean, all these chapter leads, there were some really fantastic ideas that we sort of came up with, that maybe we could do some sort of thematic discussions to engage with different chapter members on building our understanding of key global health concepts. How do we understand from different contexts, and how do we define it, and what is the, if there is a need to redefine it. And we did a Twitter chat yesterday where this sort of a comment came in, that when we refer to leadership, women leadership particularly, we often refer to the leadership at the executive level, and we miss out referring to the leadership at levels which are below that. And as Becca, you rightly highlighted that, I mean, the grassroots leadership and the women who are working on the ground, how often do we see or hear on all these high level panels? Like Anne mentioned that we managed to get AR Sindhu on that high level panel. Very less often we see such people sharing perspectives directly from the ground at a high level discussion. And that is something which would come with sort of challenging how we are defining these concepts of leadership and gender equality and global health and so on and so forth in the first place, and identifying the need on how do we go about redefining them. Anybody who would like to add to this?
May I add a level of complexity, maybe, and hopefully opportunity? Just a really important point, I think, from defining and making clear and really discussing the concepts of leadership, global health, and so on, and what they might need to be rethought. But I think another aspect to is also the horizontal one. So global health is impacted by a multitude of sectors, as raised in the previous panel, especially. And how can those discussions be taken there as well? And how can we impact gender parity and gender equity in other sectors that might be more male dominated or traditionally thought of more as masculine in a way. So that, I think that's just the one aspect, but I really like the idea and looking forward to participating in the discussion.
Indeed. Maybe if there is no more, maybe we move on to the next question. How do we encourage and build men allies? And this is sort of also builds on the points that Madhu has raised in the previous session, that how do we really build men allies in the WGH movement, and what have been different experiences or strategies tried so far? I mean, reflecting on the WGH India journey, we have a few men members as part of our group, and have been like really very strong pillars of our work that we have been able to pull it off. But sadly, the number is pretty small. So we need to reflect on how do we equally engage men, and not only just men, but people of other genders to engage in these conversations. Yeah, Lannis, any thoughts?
Yeah, so I would say, I mean, as far as the DC chapter, we don't have, that I know of, any men that are involved, but I mean, within the global health community, particularly in DC, there are a lot of strong male allies. I can name several that we have either worked with as a chapter, or I know WGH, the global team, has engaged around pushing for a lot of change, particularly from a legislative perspective, pushing for strong language around global health security, gender parity, the role that women play, but also how we can better work with men as well. So I think there are a lot of strong male allies. We have not, none of them have joined our chapter yet, but we are, as a team, thinking about ways we can better engage those male allies that are very much in touch and passionate about achieving gender equality as well as equity.
Indeed. Flata, maybe, yeah, Sarah just dropped a text that I would love to hear Zambia's allyship.
Well, it's not an easy task, I'll tell you, but we have our chapter secretary, who's a male, and we have one of the recently board of advisors who's also male. It hasn't been easy, really, to be honest, but one of the things that has helped us is more engagements in discussions. You know, you have an opportunity to talk, then people listen to you and they come up and they say, I want to be part of this movement and I want to support it. Another strategy is we just locally identify those males that are quite actively and dedicated to pushing the gender equality issue across the nation, regardless of the level. So whether they're doing it through empowerment of girls' education, whether they're doing it for sexual reproductive health engage them in discussions, and then once we do that, most of them have really been able to say, I want to be part of this and I want to support the cause. But generally it's not easy, just like any other context. I mean, we are talking about men who have always believed that women do not belong in a particular space. So to change the mindset is not always easy, but yeah, we really also could learn from other chapters on how they are doing that part. Yeah.
Totally agree, because particularly, so even at my home, and I'm sharing this very personal experience, like at my home, when they ask, like, what exactly are you doing and what is the impact that you're going to have and what will you achieve out of it, it gets really difficult for them to understand my little efforts of pushing and fighting against these patriarchal norms will really will actually make any impact or any dent on how the society operates or how the world operates. And similarly for men, yeah, so the fight continues. And yeah, so maybe Becca, any thoughts? Kaisa?
We, at the moment, we don't have any, we have as one of the founding members is a man, but he's at the moment more on an advisory level and hasn't been taking so much part in the actual day-to-day operations. So it's something that we want to work on, definitely. But I was very inspired by what Madhu said in the previous session, also on the fact that oftentimes having male allies can really help to garner more support from more males, because they might be more respected, they might be more listened to in a only male context. And so I think using this allyship not only as a way to kind of have the male perspective, it can also help in garnering even more support for the movement. I think, yeah, we don't have that much, like I said, that much experience as a chapter yet, but it's definitely something that we want to work towards.
Thanks, Becca. Yeah.
Deepika, I've been thinking about this, and I've been thinking that when we talk about allyship, we should be talking about mutual allyship, because men need us for their health just as much as we need them. So I think we've talked in the past about male allyship as though, in a sense, you know, men are holding all the power and therefore we need to bring them into our space. Actually, I think it goes both ways. And I think when it really comes down to, you know, looking at the household level, looking at the community level, very often men have an opportunity to seek health services, but they don't. And they have an opportunity to seek preventative health services, and they don't. And I think it's very clear with mental health, for example, in many communities, that men's mental health would be far better if they weren't also subject to, you know, patriarchal norms of what it is to be a man. So I think when we're having these conversations, I think we should be talking about mutual allyship, and I think we should be talking about how gender responsive health systems could actually bust through some of these norms which hold us all back and are as damaging to men as they are to women. And I think if you look at the, you know, leading causes of death for men and women, for example, you see, you know, suicide, injuries very high up there for men, far higher than they are for women. And this is the conversation that we've opened up with the Global Action for Men's Health Alliance. There's now a growing movement of organizations, not as big as ours, and not as geographically spread as ours, looking at men's health. And I'm coming to the view that rather than trying to bring in a way men into our organization, that if we can follow a twin track approach, and there be men's health organizations working on men's health, and we can be working on the women's side of gender equity, and then we meet in the middle. And where we meet in the middle is gender responsive health systems, and the idea that gender equity is actually good for everybody's health. So I think in a way that's the way I'm seeing it. I think, you know, we spent 30, 40, many years, decades, trying to get men into the feminist movement, and maybe it's not the right way to go.
Yeah, indeed. I think you've raised a very important point on mutual allyship, that it shouldn't be one way and actually be both ways. Indeed, and for particularly for it to be sustainable. And we are not talking about a short fight or something like that. It's a
Mm,
long journey, and everybody has to be on board for this.
mm.
Indeed. Um, so maybe I'm just trying something. We have a lot of participants in case somebody is interested in sharing any thoughts or reflections on the discussion. Please feel free. I have a bunch of questions which I can hold on. Uh, anyone? Okay. Maybe meanwhile they figure out the audio video mute unmute business. Maybe I was sort of wondering that what has been the key challenge in mobilizing the efforts within our country chapters, particularly because as and you also highlighted in the beginning that everybody who has been engaged in chapter development from the global level to the individual chapters, uh, all of us, mostly all of us, have their own primary jobs, and we are working on a voluntary basis. And to sustain and to come this far with the voluntary effort is commendable. But there are numerous challenges that comes with voluntary work, and particularly when we see majority of these members are women who are dealing with triple care burden and so many other responsibilities. How do we go about it? And what are the challenges in your specific context, and how have you understood it, or if you have managed to dealt with it, maybe you can share some reflections for other chapters to learn.
I can go first. I would say at least I think you kind of hit the nail on the head with it being voluntary. You know, a lot of us are doing this work outside of our full-time jobs, but in addition to that, I think with the COVID-19 pandemic, it has added additional things from taking care of your family, your children, things at home, plus juggling work and a whole heap of other things, particularly if you're also taking care of family members that are dealing with healthcare related issues. I think for the DC chapter, we were, as far as our executive committee, we were doing monthly meetings, but we found that it really wasn't sustainable. I think we were finding a lot of burnout within our members, and not really from our work with WGH, but mostly from our work outside and within our full-time jobs or home related things. So one thing that we decided to do starting this year is kind of switching to more having quarterly meetings where we'll meet every quarter, but we have different subgroups. So we have one that focuses on events, one that focuses on membership engagement, and another one that focuses on fundraising matters. And we have subcommittees, and the subcommittees might meet on a bi-weekly, every other month basis. And then when we reconvene in our quarterly meetings, we can report out and kind of go with a plan on what things that we want to do. We just started that actually this month, so I don't have a lot of reflections yet to share, but I do know from our past of meeting every month, it just really wasn't working and really wasn't sustainable for us. So we're trying out this new model. I'm hopeful that it will kind of work out a little bit better, because it allows time. As women, we wear different hats and we do a lot. In addition to our commitment to the work of seeing gender transformative leadership and gender parity, but it's, trying to find that right balance between everything.
Thank you so much. And we are going to look forward to more insights on how this works out, and share some, exchange some learnings around that. Yeah, we have been sort of facing similar challenges and sort of thinking, how do we engage members in which they equally feel invested in, and they would want to spend time, and they also see value in the time and efforts that they're putting in. So again, it has to be both ways, and we are still thinking through these strategies on how do we engage members better. So we are definitely going to reach out to you for more inputs and how your strategy works. Anybody else? Kaiser, Becca, Flata? Meanwhile, for the participants, you can now unmute yourself in case you would like to. After this question, we can go there. Yes.
Again.
Okay, so sorry, please go. Please go.
Kaiser.
Oh, go on, Flata. All right. Just a few points on the. Yeah, I think I mentioned about the good and bad sides of the virtual pandemic ways of working and the impacts of that. We are also a voluntary organization, so that does or everyone is working voluntarily. So that's another aspect to it, and really interesting to hear views from that were just expressed and similar experiences on how difficult it is really to even if you consider issues really important and the work itself is you are committed to it and it's inspiring and important. Sometimes it's also important to take care of kind of your, or in this case, the chapter, the empathy kind of towards your chapter and your work, and make sure that you also have that strength after this long pandemic to continue promoting these issues. So interesting to hear, and this is also something we kind of thought about when we developed the idea of sharing stories, so that different kind of experiences, every experience is different, could be shared. So those points to add.
Thank you. Flata?
Yes, so yeah, the challenges are quite similar across all the contexts. And one of the challenges, one of the ways in which we have tried to work around as a chapter is to develop working groups. I know in the initial meeting of the Women in Global Health Town Hall, I had indicated that we'll share more in the next meeting. So maybe I could also share here. So we have a research group, we have a media advocacy, and also a training group. So with the research team, what the research team is employed to do is that they are pitching for projects. And I think I should mention that we've won one already with UNESCO. Concerning sexual reproductive services within institutions of higher learning. We'll be doing an assessment, of course, led by the chapter director. Yeah, so it's one of the ways in which we're trying to mobilize resources so that we can engage our members, because it's really quite difficult to have the members come in, you know, giving their time, and then at the end of the day, not feel appreciated or incentivized. And yeah, but we hope that as we go along, more of those projects, if we're able to get them as a chapter, then we'll be able to support and even, you know, give time to those women and members who are not working, so that they could take up more full-time job for the chapter, because it's really quite demanding. And it would help to have people working on the ground full time. Yeah.
Yeah, very, very interesting. And yeah, some of the thinking has been going on along these lines within India chapter also. It will be interesting to share reflections. Any more thoughts, Anne? Any reflections from what you've heard from different chapters? On how to mobilize efforts and how to engage members?
I think it will be easier post-pandemic, whenever that is going to be. I think we're facing, you know, particular pressures, as Anise says, and women are particularly facing pressures during the pandemic. So I think we've got to find ways of engaging women that are easy on their time and don't add extra demands. I think that would be the only thing. And yet on the other hand, there's more need now and there's more opportunity now to work together. So I think there are a lot of prospective members of our chapters out there who don't yet know about us. So networking again is very important.
Indeed, thanks. So maybe I have anybody from the audience who would like to ask any question directly.
Sorry, Deepika, to interrupt.
Yeah, please.
Sorry, I was just wondering if I could add something very small to the previous question that you made. I think that something that we're seeing, especially during this event, is that cross-chapter events and get-togethers and whatever it may be are very powerful because, as Anne rightly said, it's a movement that doesn't necessarily tell the chapters exactly what to do, but rather the chapters decide that on themselves. And I think that learning from the different experiences of the chapters is very enriching. I always, after the town hall, I always have a million ideas floating around in my head that I feel like we could implement here. And I'm sure that the same happens to the other chapters as well. And I think that going forward, as Anne said, there's a lot of chapters that don't know about us yet, potential chapters. And I think that we as chapter members can also play a role in promoting becoming a chapter for the different people that we've met along the way. We're currently doing that as Women in Global Health Chile. We're really trying to mobilize the region. We're really trying to get all of the different countries from the region on board. Mexico's forming a chapter, Peru, Bolivia. Now we're going to meet with Paraguay soon. So it's really, I think that can be something that going forward can really create the change. Because Women in Global Health is growing so rapidly. And I think that if we get the support of all of the chapter members who are 10 or 20 per chapter, and now we're going to be 50 chapters by the end of the year, that's so many people that can mobilize their contacts and their networks to maybe even have a chapter in every single country of the world. I think that would be probably the goal. So yeah.
Totally agree. Sarah, maybe would you like to come in and share some reflections? Sarah?
Deepika, are you putting me on the spot?
Sorry, but we thought that, yeah, I mean, you were engaging in the chat box. I thought you might as well come in and share something.
Yeah, I think this cross-chapter engagement is so critical because a lot of chapters are going through very similar issues, and even though the contexts are of course very different, when chapters are able to come together and learn from one another, then we're able to strengthen our movement. When chapters are able to take best practices from each other in terms of governance and mobilizing resources and working on specific issues. I think that's really what makes us unique, because we aren't just only global South or only global North or only this or only that, but it's very much putting everyone on an equal playing field, and I think that's truly unique about our movement. So really, just kudos to the WGH India chapter for organizing all of this today, and to all of the chapters who are attending and speaking. I'm just really inspired by all of you. Thank you.
Thank you so much, Sarah, for sharing that. Bartho has raised his hand. Would you like to come in? Or also, I was checking if there are any men in the audience who would like to engage or share some reflections. Ravi, sorry to put you on spot, but just in case you would like to come in and share maybe for a minute or two on how does it... Yeah. Thanks,
No,
Ravi. I'm really sorry for putting you on the spot.
I think men need to be put on spot. Nice. Thank you. Thank you. This has been quite enriching, and my sense is that this movement is really a struggle to take the discourse from a confrontation to a position of a dialogue where there is a no zero-sum game, in this whole process. And I think that language and that kind of evidence which would make men to see that they are also equally oppressed from this this regime of patriarchy, is so critical for this kind of for sustainable discourse and movement like this. I think Anne said so well that for so long we have been within the women's movement, have been trying to engage with men, and they always think that this is either a zero-sum game, they are going to lose, or they are being used as an instrumental for somebody else's objective. And I think it's high time that we move beyond that kind of language and discourse, and make it everyone's stake. And I also agree with someone's comment that there are men who are in the part of this change process. The problem essentially with the men is that they don't the peer pressure to work against equality and equity is so much on them, because the whole philosophy, the masculine norm is so much governed by the philosophy of inequity and power, that very few men really stand out of the line and show that, look, I'm not in that power game. So dismantling the masculinity norms and masculine ideas is core to this to journey. And I think there are many men allies who are perhaps quiet. They have to come out of the closet. And I think this kind of movement that Women in Global Health, and I see my colleagues here within the India chapter, like you all are doing such great, open-minded, inclusive discussions, which is reaching far and wide. I also want to remind myself and everyone that women who are in positions of power, or who are in positions of in any position that can make a difference, should be the primary ally. They need the intersectional disadvantages that come out of the caste or class is so much pervasive that even women of privileged classes and castes need to rethink as how they strategize promoting other women, the women of Dalit, let's say in India, Dalit women leadership, or women coming from the disadvantaged groups, and that would set an example of inclusiveness in promoting leadership and giving the voices to those who have least voice in this whole process. I think generally the idea of reaching out to the most marginalized person is, in Indian context, is Dalit women, and the women on the end of the ladder, and all the women who are in positions of power. They need to have a discussion which brings in this intersectional disadvantages that are happening to the women of other disadvantaged groups, and that will really break the break the vicious cycle where men resort to usually within that power hierarchy. So I think this is an ongoing struggle. It's an ongoing, but then I see different kinds of allies, from men, from women, some of them are vocal, some of them are quiet, some of them are doing their work in their own spheres. And I think WGH would do very well in bringing all that into focus. So I'm really happy to be part of this. I'm very proud to be part of this. So thank you very much for putting me on spot.
Thank you so much, Ravi, for emphasizing these two very, very critical points on mutual allyship and breaking the typical discourse that we have been following all this while, and engaging everybody from all the genders equally, and investing in them, and making sure that everybody, it has to be everybody's problem to be able to engage equally in that, and also on the representation and going to the so if we can't bring women to the table, and this is what also came up in yesterday's Twitter chat, we'll have to take the table to the women, to be able to have their voices heard and represented in all the mainstream policy discussions and global health policies. So thank you so much for sharing those reflections. Maybe a last check, Bartu, if you would like to come in quickly. You had raised your hand. Yes. I'm sorry, I'm not able to hear you. Maybe, I'm sorry, I'm not able to hear. Is it only me or no? Maybe would you like to share? Yeah,
Hello.
please. Yes, yes, we can hear you.
Good afternoon, evening, morning to everyone who's tuned in. Sorry, I was trying so much to get back after the meeting cut, but I've learned one or two things. First of all, I would like to congratulate India for your 1-year celebration. Wouldn't miss this event for the world because we are heading there as Zambia as well. And I'm sure we can always learn from other chapters and how you're managing even amidst COVID-19. So thank you for the opportunity to be part of this meeting and for the lessons that I've learned from the various speakers that have shared so much. I think these are valuable lessons, and I like the fact that it was mentioned to say much of the things that we want may not be given to us freely, but we need to push for them and to know what our rights are. We know what we are asking for as women in global health. And if we really keep our focus on those things that we are asking for and we push the agenda, then change is definitely going to come to us. So congratulations, India, for your 1-year celebration, and keep up the good work. And thank you to everyone who managed to share one or two things. The lessons were very, very valuable. I think I'll have to listen to the call again and to continue learning more from other participants. Thank you.
Thank you so much, Bartu, for sharing these reflections. Thank you very much, and for your wishes. Really appreciated. Maybe I see it's already 3 minutes past the time, so maybe I'll just like take 1 minute of quick round and request all the panelists to give like a short, super fast response on that. See. All of us have sort of understood that this is not a short fight. It's going to be a very long fight, and going to continue for decades and maybe even centuries. That's sad to say and visualize when I'm saying that, but so in keeping that in mind, I mean, what is it that that keeps you going, keeps you motivated through this entire journey? What is one message, maybe key message, that you would like to share with other women, and particularly the younger generation who is looking up for role models? That how do they continue on this journey when they've just started and they know that it's a long way to go? And I see you're unmuted. Would you like to go first?
Yeah, I would say be a difficult woman. You don't need to be nice, and it won't benefit you if you are nice. So you can afford to be difficult. You must be difficult, and find your tribe. It's really important to find a group of people that will help you stand up when you fall down. Because, as you say, this is a marathon. It's not a sprint.
Indeed. Thanks, and Becca.
Yeah, I really want to echo what Anne said about finding a group. I think that this is not something that we can do alone, and that's also why I'm very passionate about women in global health, because I feel like it is that group. It's that group of women and allies who have come together for this joint cause and who are all working voluntarily mostly to make these changes happen. So I think just finding the topic that you're interested in, the area that you're interested in, and then consolidating a group and working together.
Thanks. Planis?
I would echo the same that those group of people that are your tribe, particularly when you have those hard, challenging moments, will be there to pick you up and keep you uplifted and moving forward. But I also say patience as well. Again, as Anne said it best, it's definitely not a sprint. It is a marathon. And I think for women like us that are in this movement, and even for the younger generation that's coming along, also developing some form of self-care routine. You know, it gets tiring. Sometimes it can be taxing not only on your physical health, but your mental and emotional health as well. So making sure you're putting in those things in place to kind of help you rebalance yourself, particularly when you're feeling defeated, whether it's mentally, physically, or emotionally.
Wonderful. Thank you. Kaisa, Flata? Yeah. Kaisa?
I can start. As you see, the Finnish day is coming to an end here, so we're running out of light. Apologies. So I think that, as already mentioned, it's all about people. So it's just important also to keep connected, reconnect, and connect more broadly, and for strategizing, but also for knowing that there is that group and community, and also celebrating, like you have gathered us today here. I think it's really important to also remember the successes. The underlying gender inequalities they are not a new issue, but I think it's I think I answered in the previous answer that now is also the time to change those and impact in that. To ensure that we have more gender equality, gender equity, and also more resilient and prepared health systems and preparedness systems for future crises and for those future generations. So thanks again thanks for this session. I've learned a lot, and we'll bring back. Hopefully, there are also a lot of our chapter members online. It's really fruitful. Thank you.
Thank you so much, Kaisa. Flata, last thought from you.
Yeah, again, I think I'll just echo what everyone has said. Networking. I think it's what's going to keep a lot of us going, especially because there'll be times when we feel like we're not getting anywhere. But listening, you hear the successes, the struggles along the journey, it really is encouraging. So yeah, also building networks across different levels so that the networks can get even bigger and broader, so that at least through that, we are able to tackle different aspects that are influencing the gender inequality. Yeah.
Wonderful. I think this has been very inspiring and also slightly overwhelming for me personally, to hear and collectively reflect and exchange thoughts and ideas on how we are within our own country chapter, sort of building this whole movement, despite all the challenges of voluntary work and not enough. Male engagement and things like that. So very interesting conversation, and also some beautiful ideas to take them forward, and more so on engaging with these chapters more frequently on thematic discussions, on the challenges that we are facing, on exchanging, I mean, just like a coffee hour session or something like that. Yeah, I mean, I'm really excited and looking forward to more such interactions with the chapters and the global team, and engage further and build this whole movement stronger together. That's what I would sort of say. And also that we should never stop celebrating, even if it is a small success. We often forget to pat ourselves for what we achieve. And there is some gendered and cultural aspect associated with it, that we always think that, oh, we are not good enough, or we might have done this better, or things like that. So I take this opportunity to thank every member and every chapter of WGH family, and commending on the work that they have done so far, and taking the global movement here, and look forward to growing it even bigger. And as Becca said, like, we need to have a chapter in every country of the world, and make it like really mind-blowing. So with this note, I would like to thank you all from the bottom of my heart, and it was a wonderful discussion. I hope you all also enjoyed equally as I did, and we will continue these discussions even after the session. Thank you so much.
Thank you.
Thank you. Bye.
Thank you. Bye. Have a nice evening.
Thank you, everyone, for joining.
Thank you. And wonderful
Thanks,
presentation.
Louise.
Bye-bye.
Bye.
Bye.